Hey guys, it's been so long and I'm finally back. I'm going to be doing my countdown to due date updates from now on. Obviously, if you didn't know, I am pregnant. I am now 30 weeks and 3 days along today. And yeah, I did plan on doing like weekly updates, but come on guys, let's get real. I've been super tired. I also, work, and with my 6-year-old, it's just been hectic, so I didn't get around to filming those, but I really do want to film at least a portion of my pregnancy updates. So I figured I'm just going to do the countdown to the last 10 weeks if I make it to 10 weeks. So we will see. So just a quick update on, the pregnancy up until now, just very quick. So I found out I was pregnant when I was 5 weeks. Yes, 5 weeks. And we were very excited. My husband and I had been trying for a while, almost a year, maybe a little less, and it just was not happening for us. So we kind of just gave up and just said, if it happens, it happens, and we'll just leave it at that. So as soon as we stopped, we were blessed with the baby. So yeah, so that was that. At around 8 weeks, I was having really, really bad cramping and really bad lower back pain. I for sure thought that I was gonna miscarry. I've never had a miscarriage, but the way I was feeling, I just didn't think that it was normal. And of course, I've had one child before, and that pregnancy was so different than this one. So we went to the ER just to, get evaluated and see what's going on. They did an ultrasound, and they said, baby looked great. However, I did have a subchorionic, I think that's how you say it, I'm not sure, hemorrhage in my uterus. And what that means is that your placenta is starting to detach from your uterine wall, and blood pools between the gap of the placenta and the uterine wall. So it was a very small one, but at the time, the doctors were saying, technically we're diagnosing you with a threatened miscarriage. Of course, that does sound way worse than what it truly is. It's actually something that's very common. I never had any bleeding, which was very good, a very good sign. However, they wanted me to be very well aware of all the risks that can happen. He said, if you are destined to have a miscarriage, nothing can stop it. Even if you're on bed rest, you just kind of have to go home and just wait it out. And if it happens, it happens. There's nothing you can do to prevent it. So of course we were really, really worried. I was just heartbroken. My mind was all over the place. I was very emotional. My husband was a little scared. He's not the person to show his emotions or wear his emotions on his sleeve, but that time he did look worried, and he was very helpful with everything. He made sure that I was okay. He helped out as much as he could. I took a couple of days just to be on bed rest, it just made me feel a little better, just knowing that, if I had a miscarriage, then it wasn't because of something that I might have strained myself or for whatever reason. So thankfully, we're so blessed to say baby made it. This baby was a fighter and said that it wasn't going anywhere. So here we are, 30 weeks in, and we found out at 16 weeks, we found out that we're having a little girl, and her name will be Camilla Rose. And let's see, what else happened between now and then? I found out we're having a girl, and yeah, did my glucose test. That came out perfect. Nothing to worry about. And so last week, Thursday, I was at work, and I had a pretty sharp cramp that kept coming on every hour on the hour. I was getting a little nervous because of how consistent the pain was, and at the time I was only 29 weeks, so I was thinking, this can't be labor, it's way too early, it's just not good. So I got worried. I actually have some family members on my husband's side who said that she went into labor at 29 weeks. When I heard that, I got pretty scared, because I'm like, okay, well, it's not an impossibility. I could be in labor. Hopefully I'm not, but I could be. Called my doctor's office. They suggested for me to go check into labor and delivery. They'll evaluate me. If I'm good, they'll send me home. If not, we'll take it from there. So that's what I did. I went to the hospital. They determined that I did have one real contraction when I was there, but they also did a swab test, and they were testing for, I'm not really 100% sure what it is that they test for, but it pretty much can detect if you are, at risk, higher risk. That's my son, you guys. If we are at higher risk to have or to go into preterm labor. So, hi bud. Okay. So they determined to see if I was at risk. My test came back negative. They did a urine culture and a urinalysis, and that came back normal. They said baby girl was doing perfect. Her heart rate was very strong. Now, like I mentioned, I did have one real contraction. Doctor said that was nothing to worry about. And, the uterus is a muscle, and muscles contract. So there's nothing to worry about unless I'm getting more than unless they're more than 5 minutes apart together, or I don't know if he said 5 or 10 in an hour or something like that. I'm not 100% sure. I can't really remember. But so that was at the ER. We're at the labor and delivery department. They said everything looks fine, everything checked out. They sent me home. So I was very, very happy that it was not real labor, because that was scary, because I was only 29 weeks. So yeah, that was that. Then on Thursday, this past Thursday, today is Friday. So just yesterday, I had my 30-week appointment, because now he is wanting me to go every 2 weeks to do bi-weekly checks on baby girl. And he said that he looked through my records from the hospital. Everything looks like it's fine. He reassured me that the second pregnancy is much more symptomatic than the first one. He said labor I shouldn't expect to be as worse. Usually second time moms have it a little easier, but I'm not sure how true that is. So he did also mention that someone with my history and with checking my labs and all of that stuff, that it is very rare for me to go into preterm labor. He confirmed that it's not common in my case. Now, he did say it's not an impossibility, but it's very rare in my case. So yeah, that's pretty much you're caught up from when I found out I was pregnant till now. So some of the symptoms that I've been having as of now is, you guys, is dry skin. Like, oh my god, I've never ever had dry skin. For as long as I can remember, I've struggled with oily skin, which I might look a little oily right now, but that's just highlighter actually. But yes, dry skin all over my body. My hands are super dry all the time. I am struggling really bad with the little patch right here under my nose. You see the redness? I've always had redness there, but right here I have a little patch of scaly little dry patches, and it is just so annoying, because when I do put my makeup on, my makeup will cling on to my little dry patches. So I have a little dry patch here, one like right here, right above my eyebrow. Down here, it's just so bad, you guys. So I'm working on restoring my skin to the best that it can possibly look, because as of right now, it is just a no-go. So yeah, dry skin everywhere. My tummy is very dry, so I've been lathering up on this cocoa butter stuff, which smells so good. And also my hands, like I said, very dry. My whole body is just very, like, I feel like I have just dry skin all over. So as soon as I get out the shower, I have to moisturize a lot. So my morning sickness is definitely still lingering around. I don't know if it's still considered morning sickness, but again, it's mainly in the mornings, and it's usually when I'm brushing my teeth. Like, I have my good days and I have my bad days. Some days I just throw up like all of my dinner, and some days I'll just dry heave or whatever. But for the most part, like, it's still kind of lingering around, and it's just something that I don't think I can ever get used to, because I hate throwing up. I don't think I know anybody who likes throwing up. But anyway, yeah, so morning sickness is still there every now and then. My very, very dry skin. My weight gain so far, I am now 7.5 months, and I have gained a total of 11 pounds, which the doctor said is perfect. It's really good. And let's see, I have been increasing my water intake. I try to drink anywhere between 6 to 8 water bottles a day. which is so hard, mainly because I am now using the restroom like every 20 to 30 minutes. It feels like I'm always having to pee. Like before we leave anywhere with my husband, he's always reminding me, use the restroom before we leave. Or even when we're driving, sometimes I'll have to be like, dude, I really need to pee right now. You have to pull over so I can go and pee. So yeah, it's really hard to keep drinking lots and lots of water, but it's very important to keep yourself hydrated, you know, to make sure that you're not cramping or anything like that. So yeah, let me see what's another symptom I think I may be having. Oh, this might go hand in hand with my dry skin, but I've been having like really bad itchiness, like all over my body. I do suffer from eczema, so as of right now, I was having a little bit of a flare up, but one of my doctors did call me in some, what is this? The triamcinolone, which this stuff works wonders. So I'm working on getting my eczema back under control, but like even my tummy, like when I scratch, because I'm sorry, I can't help it, I have to itch, and it's not scientifically proven that itching your scratches is gonna cause stretch marks, but whatever. Yeah, I started to have a little flare up on my stomach as well, and I think it's because of the dryness that I'm having. I get very itchy, so again, I'm trying to do this where I have my eczema flare-ups, and then, you know, lather up on this stuff. So that is pretty much it, I think, as far as like symptoms and everything like that. So I will be, like I said, filming the last 10 weeks of my pregnancy. Hopefully, if I make it to that, we'll see. I'm really hoping she comes like at 38 weeks or something, just because I'm so ready to meet her. I'm so excited, and yeah, I can't wait. I'm so anxious just to have her here and hold her and kiss her and just have her all to myself and my husband. So my son is very happy. He's very excited that he's going to be a big brother, and I can already tell he's going to be a great big brother. So she's going to be a blessed little girl. Everybody's very excited to meet her. And yeah, so again, going to be filming the last 10 weeks, and I will be filming every time I go to the doctor to give you guys an update. So for right now, it'll be every 2 weeks until he changes it to weekly. Now, I do plan on also filming like what's in my hospital bag and what's in baby's hospital bag, as well as like a room slash nursery tour, because she is going to be sleeping in this room with us, and this room is pretty big, so I'll be filming that as well. When I do film those, it might be, you know, not on the day that I go to the doctor, or it might just be put together. I'm not sure exactly how I'm going to work it yet, but definitely look out for that. And I'm so excited because Sunday is one of my first baby showers, not including the one from work that the ladies at work threw me. So I'll also be filming like a baby shower haul, showing you guys what I received as gifts and stuff like that. So look out for all that stuff. I'm very excited to get back to filming this, and so without further ado, I'm going to go ahead and just show you guys the bump, and we will end the video here. So here she is from the side, from the front, and from the side again. There we are at 30 weeks and 3 days. So that's it, you guys. I will see you guys in my next video, and I will talk to you guys soon. Bye. My son didn't want me to end the video without him being in it. So are you excited to be a big brother?
Yes.
How excited are you? So excited?
Yes.
Are you ready to meet her?
Mhm.
Are you gonna help me change your diapers?
Yeah.
Are you gonna clean up her poo-poo?
Mhm.
And what about give her some milk?
Your chi-chis?
My chi-chis?
Mhm.
You're funny. Okay, say bye, guys.
Bye, guys.